I want to start to say the most important thing, that why are we doing this? We are doing this foremost for the patient, and the second, the health professionals. We have a lot of health professionals that don't think we are giving the right kind of support to them today. And we are also making this for the decision makers. If we have right kind of data, we can be able to make more correct decisions in the future. I want to make a little discussion about why are we working with eHealth. And I want to say that eHealth is a tool. The health is the goal. Let's see. There we go. First of all, if we work good with eHealth, we can make the patient a partner in the work of health. Because we know from a lot of research that when the patient is a partner, you will get better result. If the patient is merely a patient, then the result will be less good. So we want to make the patient a partner with the healthcare sector. I'm not really a friend of this. There we go. Wow. This is good. Another important thing is with a healthcare sector that is much more specialized today than 20 years ago. A lot of patients experience that it's hard to know where to go, and it's very important if you have the right eHealth systems that we can manage the patient's way through the healthcare system, from the local healthcare services to the hospital and back to the local healthcare service again. And we can provide a solid base for knowledge-based eHealth healthcare. And we can also, as I said in the beginning, provide a solid base for decision makers. Am I controlling?
No, you are not in control, Martin, sorry.
No.
They are in control.
Okay. So, nevertheless, here is the Swedish healthcare system and the democratic system in Sweden, because it's important to know this. As you see in, and I won't even try, I'll use my own laser beam. We have pretty much the same. We have a national level, and we have a regional level and a local municipal level. The regional level is mostly in charge of the healthcare. But the national level makes the laws and have a lot of responsibilities within the healthcare sector also. The local level are providing the elderly healthcare. So there's a lot of connection between the different local, regional and national levels. But nevertheless, we have 3 different elections and 3 different ways to manage this. Next picture. And this is the picture of Sweden. We have, as I said, 21 regional or county councils, and we have 290 municipalities. So it's a lot of things to care about. The municipalities and the regions have we have financed ourselves with taxes, and the patient pays only a small thing up front when he gets care. We have about 1,000 primary care centers and around 70 hospitals and 70 hospitals and 7 university hospitals. Next picture. And keep them coming. I want to say, even though we have a very decentralized healthcare system, we have pretty good results. We have a very old population, the oldest actually in the EU and Norway and USA. And we have moderate costs as percentage of the GDP. We have fairly long waiting times within the elective care, but we have pretty good outcomes. We have low infant mortality, low avoidable death, and low avoidable hospitalization rates. And we have low mortality from cancer and good results in treating heart failure and high medical quality, low percentage of revision and infections. So even though we have a very decentralized system in Sweden, we have pretty good results. And I want to point out that the most important thing is, even though we have moderate costs, we have pretty good results. And all the time when we look at this, you don't have to have the highest costs. If you have high costs, it probably indicates that the quality of the healthcare is not as good as it could be, because it costs a lot to have a lot of revisions and infections. So if you have a good quality in the healthcare sector, you might also have lower costs. And I think that's important to point out. Next picture. This is the present status of the eHealth work in Sweden. During the 1960s and 80s, we had experimental work with eHealth. The first generation of EHR or EMR, or health information systems, you can call them whatever you want, was very local. And the second generation was hospital-based. The third generation, and this is where we are now, the county councils tried to gather the health information systems within themselves. And the fourth generation, this is where we are now. Now we are trying to gather all the information at the national level. And this is what I want to talk about today. Next picture. Wow, this was a few examples of what we are doing. If you have the time, you might want to go to some websites. They are also translated into English. So one of the things I wanted to say is eHealth is much more than the health information systems. eHealth is about providing the right kind of information to the patients. If the patients have good quality information, then they might not even need to go to a hospital or a local healthcare. And this is also where we can save a lot of resources, and this is also where we can mitigate the consequences of climate change. Because if we have a system where we don't need to travel as much, then we don't emission as much carbon dioxide. So the healthcare sector can also be very, very good in working for a better climate or less climate change. But we are doing a lot of other things in Sweden also. We do a lot of work with the infrastructure. We have an information security solution that includes hard certificates. So all the co-workers in the healthcare sector has his or her own card, and we have a database where it says what access every co-worker actually has in our different systems. So we have pretty good security measures. They can always be better, but we have a good base and solid base to stand on. We do have a national patient oversight, which indicates that if you are a health professional with the right approvals, you can see a patient's diagnosis, his appointments, his prescripted drugs, and if he have different kind of allergies. And this is on the national base. We also have the possibility to view directly into the electronic medical records on the web. And this is a solution that we at the moment are rolling out in all the county councils. And we are also working with full information about what drugs are prescribed and what drugs are fetched out from the pharmacy, so the doctor has the full information. This is one point where we know that we have a lot of quality loss, because the doctors don't know what a co-doctor has prescribed. So this is a very important issue to have better quality in the healthcare. So all the doctors have the same information at the same time. And we also have solutions for video conference and telemedicine. And here also, again, if we can make this work much better, we can have a much more efficient healthcare sector, and we can actually have a better learning also. Next picture. And this is what it takes to work. We have to work in different levels. First, the national government level need to bring the laws and regulation into place. A lot of things are moving very, very fast. So laws that were passed in 2006 are too old because we have the cloud computing and we have big data and we have a lot of different things that make the laws old very fast. We need to work a lot with information structure and terminology. I heard once the example, and I think it's a good example, when they tried to put together two different databases, and in one database they coded woman as 1 and man as 2, and in the other database they coded woman as 0 and man as 1. And when they closed these two databases together, it was chaotic. So it's extremely important to have the same information structure and terminology. And this is something that we need to do on national basis, on international standards, so we can actually come together internationally in the future. We need to enhance the technical infrastructure, and that was the same in Indonesia. We need to facilitate interoperability, and that's the same as in Indonesia. This is the healthcare or the region's responsibility. So, and we need to launch new e-services for citizens. The point being in this picture is that we have different issues that we need to take care of on the different levels of the healthcare system. Next picture. So, moving forward, I'm moving forward quite a little faster than I had anticipated, but moving forward into the unknown. Next picture. As I pointed out to you, we are now in the phase of trying to implement the 4th generation of HMR or EMRs. And they should be national based with global compatibility. So this is where we need to have the global information structure on place. Next picture. This is how it looks today. And if you, it's hard to see, but this is Sweden with all its regions. And today, it's not really true, but if we are simplifying the picture, every region or every county has its own database storage. And this database storage is not only one database, it's a lot of different databases that goes into one database. In my county, the region of VästraGötaland, we have actually a lot of different databases, so it's not as simple as it is drawn on this very complex picture. Next picture. What we want to do is have the Swedish as one nation. Even though we have the 21 county councils, we have one redundant safe storage. And coupled to this safe storage, we have different databases that can describe, for example, access to care, quality registers, what we achieve in the healthcare sector, NPO, which is the oversight. We have a lot of different databases that we want to put into one redundant safe storage. And back to basics, we need to have in focus the healthcare service person, the nurse or the doctor, and the patient, and what they are doing. They need information to make the right decisions. They need to retrieve information, they need to make a decision, and they need to document what they are doing. And this is all this information we want to have in one redundant safe storage. We also want to bring, and that's all that information goes down in this redundant safe storage. And we also want to provide a good information for decision making back to the professionals, because this is where the healthcare sector actually is today. To be able to give the best care available, you have to have a lot of good information. So we don't just collect information for our own good. We collect information to be able to give it back to the healthcare professionals to be able to make the right kind of decisions. Next picture. To be successful in this field, I'm sure that we need to have the insight that this future will not wait. We have different solutions from Google, from Microsoft, from other vendors, and we really don't know what kind of security they have. So if we wait and if we don't go forward, we will have different kind of solutions. They will probably not be compatible, so it's important to move swiftly. We need to recognize that eHealth investments are long-term undertaking, and we also need to recognize that this improves healthcare. If we do this in the right way, we can have a better healthcare sector than if we don't do it. We need to have a clear definition of roles and responsibilities. As I pointed out earlier, the national level has its responsibilities, the regional level has its responsibilities. The work must be carried out coordinated and parallel towards the same goal. Everybody needs to have the same goal, and we need to work together. And all the stakeholders must be included. And this means the regional, the municipality, the national level, the health professionals, and different companies that work in this sector. And the most important point of this presentation is we need to have good governance. It's critical to be able to, I think you had taken the next picture. And on the bottom here, we have the 21 independent county councils. They are mostly going in the same direction. But some county councils are far ahead, and some county councils are trying to go back. So even though we have this decentralized model, we have to have a system of governance. And in Sweden, we have a body of how we do this, and this is where I'm the chairman. Next picture. Keep it rolling. And here is a picture of how we do the 21 county councils, how we work together to make this happen. But we also have to have in place the municipalities and what they think, and we also have to have the Minister of Health and Social Affairs and the national levels present when we are doing this work, because otherwise it won't work. Next picture. So the biggest obstacles is not really related to technology. It has to do with imagination of to see what tomorrow brings. It's hard in this very fast-moving environment. We have a lot of ethical issues about integrity. Can we really collect so much information about the patient at one place? We have judiciary issues. Is it legal to collect all the data in this way? We have a historical heritage, a lot of different databases that need to be connected. We have culture, and this is also very interesting, to make such an easy thing to make it possible for the patient to book his own time. The doctor needs to be able to give his calendar to the patients. And we also have a lot of discussions where we know that one patient might know more about his or her illness than the doctor. And the doctor will be a co-creator of health, and the patient will be the expert. And this is big cultural differences and big issues within the healthcare sector. We have the lingual issues, information structure and terminology, very big obstacle. And lastly, we have the management. In this extremely complex environment, we have to have good management. Next picture. And my point is that this is not easy and it is not fast, but it is possible and it is necessary for the future. Thank you.